All right. Welcome, Amy. Thank you so much for joining us today. I'm so excited about this conversation about low stomach acid, how to prevent that, what that really means, and what that can mean for individuals with acid reflux. All right. So before we dive in, if anyone is not familiar with Amy Hollenkamp, she's an amazing registered dietitian. And would you like to just give a little bit more background on who you are and what you do?
Yeah. So, as Molly said, I am a registered dietitian. I specialize in IBS and SIBO, so small intestinal bacterial overgrowth is my main specialty. And I work with people all over the place. I'm also a blogger. So if you do have SIBO or IBS, or even again, just struggling with, sounds like acid reflux is a big issue for a lot of your audience. Mm-hmm. There can be a lot of underlying layers for that. And I think SIBO can be one of them. And I think low stomach acid can be one of them too. So I'm glad we're talking about it. But I have some resources on my website, SIBOdiaries.com, that cover some of this stuff too. So yeah, I'm just happy to be here and that we can kind of have a conversation about, I feel like, a very important topic in the gut health space. So yeah.
Awesome. So excited to have you on. So let's start just by talking about low stomach or stomach acid in general. Like, why is it important and what might happen if you have low stomach acid?
Yeah. So stomach acid's really important. And the reason it's so important is that pH really impacts every aspect of the GI tract. A lot of the environment of the GI tract is regulated by pH changes. So, the pH in your mouth, and when I say pH, I mean like whether something's acidic or basic. We're going back to high school science class with this conversation. But if something's basic, it has a higher pH. If something's acidic, it has a lower pH. So, different parts of the GI tract are more acidic, more basic, and that regulates a lot of different things. It regulates, from a stomach acidity standpoint, if your stomach's not acidic enough, it's going to affect digestion downstream as well. You want the acidity of the stomach to be there because stomach acid stimulates pancreatic enzyme release. So if you don't have enough stomach acid, it's going to prevent enzyme stimulation. So that acidity is what stimulates the release of enzymes. So as things are spitting out the stomach, that's what causes the increase of enzymes. Same thing with bile flow is another one that's very dependent on the acidity of the food coming out of the stomach. So from like a digestive domino standpoint, if stomach acid's messed up or low, I shouldn't say messed up. If stomach acid's low, it's going to affect digestive capacity downstream. It's also something from a pH standpoint, which I was talking about earlier. If low, it being really acidic also kills pathogens and helps with absorption of nutrients. So things like PPIs that lower stomach acidity basically lead to a lot of nutrient deficiencies and can also lead to being on them long term, not short term, but being on long term PPIs can lead to more nutrient deficiencies and also can lead to more infections because the acidity of the stomach is super critical at regulating pathogens and what microbes grow and what microbes don't. So again, I would say the main purpose of stomach acidity, again, is one, to digest protein, super critical for protein digestion. There's certainly some nutrients that are heavily dependent on stomach acidity. And then again, controlling digestive capacity downstream's very much a byproduct of having adequate stomach acid levels. Does that help? Does that make sense? Okay.
Definitely. And so when you see individuals with acid reflux or GERD, are they mostly individuals struggling with low stomach acid or high stomach acid, or what percentage would you say, like estimation of those individuals struggling with acid reflux have low stomach acid?
Right. I think, again, if you have GERD, it's always really critical to dig deeper as to the whys.
Right.
I find that that's not something that's discussed enough. if you're having reflux, there are root causal issues that are probably at play that are driving that reflux. You don't just all of a sudden have reflux out of the blue. Something's breaking down. And usually, most of the time, it's like a digestive capacity issue. So maybe stomach acidity. The stomach isn't acidic enough. It can lead to a lot of fermentation and pressure being pushed up, which then can lead to some reflux. Same thing with SIBO is similar to that. It can make things sort of push up, a lot of gas pressure up that leads to GERD. And when you have low stomach acidity and food's not being broken down properly and you're getting some of that fermentation, it can lead to the sphincter, or the pressure that's being pushed up can lead to that sphincter to basically allow some of the acid up. I know it sounds really counter, like on the surface, it's like, oh, you think that I have high stomach acid because I have some of it creeping up. But it honestly could be that the environments, you're not breaking down food properly, and that is causing some gas production and fermentation that's pushing things up. And the stomach acid you do have is still acidic and coming upward, and creeping into the esophagus. But it's not necessarily a high stomach issue. It feels like that on the surface. I think, because you're like, oh, I have too much. But I think a lot of it has to do with digestive capacity breakdowns. I think motility can also be at play for, and nervous system issues at play for low stomach acid and just GERD in general. If you're not moving food through the gut properly, that can be at play from a stomach acid or from a LPR standpoint, GERD standpoint. And I think, when it comes to low stomach acidity, it is a subset of what causes GERD. Not every GERD scenario is going to have low stomach acidity. I think it can be I'd never thought about putting a percentage on it. So I'd probably have to think about that a little bit.
Yeah, of course. It's a tough question.
But, I would say it's an area to explore if you do have a little bit of GERD. To explore low stomach acidity as potentially being a factor. And again, I would think of it as what breakdowns could be at play. Low stomach acid could be a factor in that. Yeah.
And so I get tons of questions on my YouTube channel about how do I know if I have low stomach acid versus high stomach acid? And I'll just also say that it's sort of a controversy, right? So I was thinking today, like, you're a gut health nerd, if like a hot topic is low stomach acid and how it can impact the body, because a lot of conventional doctors, and no shade at all towards them, but they are taught what they're taught in school, and focusing on certain research studies to do with PPIs. And a lot of them will sort of dismiss the idea of having low stomach acid, which is interesting because many people do find benefit with some high acid interventions, such as like apple cider vinegar, stuff like that. So anyway, with that sort of like disclaimer that there are differing opinions on this, I personally feel like I have experienced both at different times in my life. And so I'd love to talk about, like, how do we know low stomach acid versus high stomach acid?
Yeah. I mean, it's interesting because I do think that there are cases of high stomach acid. Some people I feel like the functional integrative space only think about low stomach acid, but I do think that there are still cases of high stomach acid. And I would say usually the people with higher stomach acid are going to have, it's going to be more histamine related. Histamine is a compound that is needed to produce stomach acidity. So if you have high histamine issues or mast cell issues, you can certainly have reflux. So it's really interesting too that a lot of like the reflux diets, low tomatoes, they're taking out things like tomatoes and chocolate and but a lot of them are histamine rich foods. citrus. Again, these are all histamine foods.
Huh.
So I think a lot of times when there's high stomach acid, it's usually a histamine issue. That's kind of my belief.
So interesting. Wow.
Yeah. And so like high amounts of histamine will increase stomach acidity. That's why there's actually H2 histamine blocking drugs that block histamine release in the stomach to shut down stomach acidity, like H2 blockers. That's what an H2 blocker is. So there can be some drugs that, if you have histamine issues, might be beneficial, at least short term, until you kind of work on some of the underlying factors. But I actually wonder a lot of times with people that have true high stomach acidity that's causing their GERD or reflux, that they might benefit from looking at it from a histamine angle. So just a thought there. But, I wish that, the conventional doctors were a little bit more open to the idea of low stomach acidity. I mean, if you look at hypochloridria is the technical term for low stomach acidity. If you look at the research, like if you just type that into PubMed, you'll see tons of articles on it. And I think that a lot of them are discussing things like gastritis. Like if gastritis is present, usually there's going to be lower stomach acidity, because if the stomach's inflamed, it's going to have a hard time producing stomach acid. Things like H. pylori lower stomach acidity, and that's been shown in papers. And H. pylori is incredibly common as a microbe. So I still think like it's always important to dig to the whys of why your stomach acid may be low, not just kind of take apple cider vinegar or Betaine HCl. Like I do think it's really valuable to dig a little bit deeper as to why that could be. But I still think that, there's a lot of evidence that low stomach acid's a major thing. Like I think there's plenty of research that shows that. And if you have a doctor that's questioning it or not open to the idea, and you're pretty intuitively, you feel like it's a bigger factor for you, I would try to find someone that does acknowledge that and has some strategies to increase stomach acidity. That would be what I'd recommend.
And try to find someone who's willing to help you navigate that root cause. I think it's really
right.
important, whether it's a functional dietitian or functional doctor. I personally saw a traditional gastroenterologist who was extremely helpful in my healing. But I was sort of on my own to figure out like the root cause and try some of the other herbal methods. And I would have loved to have access to a functional medicine doctor. And I know many of us don't. I didn't. I was a student, and it can be expensive, but just kind of planting that seed, I think, is important, because there could be underlying, whether it's disordered eating or histamine, H. pylori, stuff like that is really important to consider.
Right.
Treating the symptoms.
Right. And I feel that. And I think, again, like GI docs have their specialties.
Yeah.
For sure. And I think, again, like if we can work with GI docs and then also understand that they have kind of a limited scope.
Yes.
And that, you might need another provider that just has a different set of skills. That's sort of how I would go about doing it. But I know it could be tough if you're juggling different expenses and things like that. But yeah, I think digging to the root cause is key.
Right, exactly. And kind of being educated. And that's why I'm really glad that we have these conversations, because I think it helps educate people on their different options, and just knowing that when you go to the doctor, kind of knowing what to ask, and knowing that that's not always the end all be all. I'm not saying don't listen to your doctor, because
right.
Of course you absolutely should listen to your doctor, but I think asking questions, doctors love an educated patient. So kind of looking at the research of the PPIs and understanding if you really need one, because they're one of the most prescribed medications, maybe the most. So.
Right. Well, I think that the sad thing about PPIs too is, even if you're not necessarily having reflux, they're prescribed for things like indigestion, stomach pain, discomfort. maybe even bloating. Like I feel like a lot of people that I talk to,
Yeah.
and I'm like, did you have reflux? Did you have these things? And they're like, no, I just like my stomach felt bad. It's almost like a first line of defense for any gut issue.
Yeah. Yeah.
And again, I'm not anti PPI.
No.
I think they're overused. And then there's no plan to get off of them. So, there's certainly people, I would say there's certainly a really small minority that needs to be on PPIs long term. But most people, if they can figure out what their root cause is, can get off PPIs. And again, it's important, I would say, to talk to your doctor about a plan to get off of PPI once you go on it. I'm not a prescriber, and again, don't listen to me about jumping off of PPI, but I would say it's a really valuable conversation to bring up to your doctor, because there's a lot of evidence that PPIs decrease nutrient status, can, increase risk of infection. So, and that's well documented in the research. And so you don't want to be on it a long term, and it was never made to be on long term. So having an exit strategy and things in place to help you cope, and to dig deeper to the root cause, I think is important, so that you don't feel like you're relying on the PPIs.
Absolutely. And that's in congruency with what the conventional doctor said as well, is they're not designed to be on forever. So I liked what you said about having an exit plan and things to cope with that, and asking for help there.
Yeah. And one other thing I will say too with PPIs, it can be a little bit of a dicey road going off of a PPI.
Yeah.
Because like, if you look at the research, what happens when you go off a PPI is that the cells of your stomach lining have actually grown. They're basically trying to compensate, like overcome the PPI and produce acid, but they're being blocked. So like your cells have gotten really big to try to overcome the PPI in a way. It's like your body adapting to it in a way.
Yeah.
So what happens if you try to go off like cold turkey, it's like the floodgates are open. You have these big stomach parietal cells that are releasing a lot of acid all at once. And so a lot of people can feel pretty symptomatic if they stop a PPI cold turkey because of this influx of acidity. And so that can be kind of painful and uncomfortable. So again, having a plan laid out to where you can kind of wean, like usually if I have a client that's been on a PPI for a while and they're wanting to discontinue and they've talked to their doctor, it becomes a weaning process. So they drop their dose continually until they can go off of it.
And recently I interviewed Dr. Nicole Dinezza, who you obviously know because you have the podcast, IBS Freedom Podcast with her. And we talked all about different ways to manage acid reflux with herbs. That has been so personally pivotal in my healing. So that's a whole nother conversation. But if anyone's watching that is like curious on other things you can do, that conversation with Nicole Dinezza is awesome. All about the herbs and how to do them. So that can be very helpful.
For sure. No, I 100% agree. And I think she's amazing. So check out that video. But I'm biased, so.
So I'd love to talk about like symptoms of low stomach acid versus high stomach acid, or just anything like, what are some signs of low stomach acid that someone might observe?
Right. The big ones that come to mind are bloating or discomfort pretty quickly after eating. So if you eat a meal and, 15 minutes later, you feel pretty bad and it's breakfast, again, you haven't eaten any other meals, that would be an indicator to me. If you get if you feel like food's just kind of sitting in your gut, like up top, not moving, just kind of feels like you just ate a brick, can be low stomach acidity. a lot of times people struggling to digest protein. So they just feel like, I tried to increase protein and I did not feel good. That can be a sign. Usually, again, from a protein standpoint, they'll know like even more so after they eat, they feel like they ate a brick or a bowling ball or something like that. It just feels like early satiety, those types of feelings. Nausea can be one as well. Burping. So if you're someone that burps a lot, that can be a low stomach acidity thing because things are just fermenting and being pushed up. You can even have like some lower down symptoms as well. Things like bloating further down. Things like SIBO can be a symptom of low stomach acidity because, again, it regulates the environment downstream and the pH downstream. That's why PPIs have been associated with higher rates of SIBO, because if you change the stomach acidity up top, it's going to change the pH and digestive capacity downstream, and it makes your small intestines a little more susceptible to SIBO. So you can get more bloating and you can even get diarrhea or constipation. So it can be pretty like broad, but I would say like the textbook ones are more upper GI stuff, like, early satiety, burping, reflux, indigestion, feeling like you ate a brick, not tolerating protein really well. Those would be the biggest ones that I would say I look out for, and kind of having symptoms closer to meal times versus like, 3 or 4 hours later, that could indicate something else.
Are there any, sorry, go ahead. We're going to say something
else.
Oh,
no, go ahead.
Are there any specific foods or drinks that you would recommend to support individuals with low stomach acid?
Yeah. It depends a little bit on the cause. So, when we're talking about causes, first let's talk about causes maybe, and then we could dip into that. But I think a lot of times when it comes to root causes of low stomach acid, H. pylori is a huge one. So H. pylori can be pretty common. It's a bug that infiltrates the gut. It probably can infiltrate the gut only when your stomach acidity is low. So it's sort of one of those things where it can take over the gut if your stomach acidity is already a little bit compromised, but then it further compromises acidity. It produces compounds that shut down acidity of the stomach so it can survive better. So it kind of colonizes the stomach, shuts down stomach acidity. So that again can be a really big factor for low stomach acidity. Things like gastritis can be at play. That's again something pretty well documented in the research as well, that gastritis can lead to lower stomach acidity because your stomach lining's damaged, so it's hard to produce enough stomach acid. I think a big one would be stress, like being stuck in fight or flight. So your vagal tone's low, your vagus nerve's not communicating with the gut well, which the vagus nerve is that nerve that bridges communication between the brain and the gut. And if you have a weaker tone, your body struggles to make enough stomach acid. So if your body's like very fight or flighty, you're probably going to have a weaker vagal tone, which is going to lead to lower stomach acidity. So if you feel like you're very stressed or are like kind of locked more in a stress response, anxious, those types of things, that could potentially lower stomach acidity. So focusing on things like stress management, meditation, things that help the brain gut axis are going to be really beneficial to stomach acidity. And so that one can be huge for people. It's not necessarily a really sexy or flashy one, but it can definitely be a really common root cause. Other things are hypothyroidism can lower stomach acidity. I see that relatively often. And I think a big one that kind of correlates with thyroid issues is undereating. You had mentioned that. I mean, undereating is a big one. It was interesting. Nikki and I had herbalist on our podcast who essentially said something really interesting, which makes sense. But like, in order to make stomach acid, you need a lot of ATP, which from like a biochemistry standpoint, that's basically like cellular energy. So you need a lot of energy to make stomach acid because there's like this, this might get too sciencey, but there's this gradient that they're trying to pump hydrogen ions into this to make stomach acid. And it requires tons of energy. So if you don't get enough calories to make enough ATP, it can lead to lower stomach acidity. And I think undereating affects vagal tone and hormones like thyroid hormones, cortisol, that are going to shut down stomach acidity as well. But undereating can be a huge one. If you've been like chronically dieting, either intentionally or unintentionally, checking in on calories and making sure you're getting optimal nutrition is key. And I actually think even micronutrition can be important. So things like zinc, magnesium, chloride, adequate protein levels, can all be really important for stomach acidity. Even iron can be a big one. So there could be nutritional status aspects of it too. But those would probably be the biggest ones. And then of course, PPIs will lower stomach acidity too, which makes sense. But yeah, those would be the biggest causes.
I'm glad that we went there before talking about specific like food, treatment, anything like you might recommend as far as like concrete things.
Yeah, in terms of like foods and treatments, I think again, it can be one that's pretty individualistic. I typically think if there's low stomach acidity, I want them to make sure they're getting enough protein. I know when I was looking over some of the questions you had gathered, there was someone saying like, could the vegan diet, I don't remember, but it's something. Go ahead. Do you have it?
Her question was, can being vegan for 3 years affect or change your stomach acid?
Yeah. So, and I don't necessarily, I think you can be vegan and have good stomach acid, but it is something that in my vegan clients, I've definitely seen more low stomach acid. And it's probably more so to do that they're eating a little bit less protein. And if you don't eat as much protein, it's just naturally going to lower stomach acidity. You can also potentially develop some more micronutrient deficiencies, like zinc's a big one for stomach acidity, and iron, which, typically are harder to get on a vegan diet. So if you're supplementing well, there's less of a risk. But I think protein's a big one. So trying to eat protein pretty regularly with each meal will typically help stomach acidity. I think, things like spicy foods, things like acidic stuff can sometimes be irritating if there's something like a gastritis or an H. pylori going on. So, those could be things to potentially remove. I would probably focus primarily on what the root cause was. So if the situation was gastritis, I might recommend different dietary interventions than if it was undereating and cortisol stuff. Like just getting nutrition up might help then. But if there's like an H. pylori scenario, sometimes there can be a little bit more irritation. So, we might want to avoid different things that could potentially affect the stomach lining. But most of the time I'm trying to work pretty closely with my clients to determine, what their triggers are versus just removing things willy-nilly. So usually with dietary interventions, I'm pretty keen on avoiding unnecessary restrictions, but I really want to make sure they're the primary goal nutritionally is that they're replete with macro and micronutrition that will support stomach acidity.
Awesome. Yep,
yeah.
That makes sense.
Yeah, for sure.
So we got some really, really interesting questions, and I think some of them are going to be sort of like debunking questions. So one of the first questions, which I think was already answered, was do PPIs help with low stomach acid? And I believe the answer is no.
Yeah, they don't. Again, I don't want to totally poo-poo on PPIs
Oh,
because
no, not at all. Yeah.
yeah, I do think that there's a time and a place for a PPI. If you have like pretty strong gastritis or an ulcer, like take a PPI, but still have a plan to come off of it. I think the problem is GI docs are like, oh, here's your PPI. And then there's no plan and they're on it 10 years later, they're still on the PPI. So I think that what I would say is it's not going to help with stomach acidity unless there's like, an ulcer that needs to be healed up so that you can make stomach acid in the future, but it's going to lower stomach acid is what it's going to do.
Right. Yeah, that makes total sense. And absolutely no shade towards PPIs. I was on them for a long time. So
yeah,
it can definitely be necessary. It's just
right.
really understanding whether it's necessary and knowing how that exit strategy.
Right, for sure.
Someone else asked how to tell if you have low or high stomach acid is causing your reflux.
Yeah, I mean that's an interesting question.
Yeah.
I'd probably run through the symptoms that I just mentioned. Typically people that are having higher stomach acidity, like from something like histamine or mast cells, are probably not going to get as strong of like feeling like there's a lump in their gut, feeling like they're burping all the time, like feeling like just digestion's halted up top. I bet they're not going to have as many of those symptoms, but they can still have like some of the burning or like acid in the throat, like the reflux type symptoms. So again, I would try to analyze your profile of symptoms. I think if you're someone who's curious about low stomach acid, sometimes just trying HCl could be pretty indicative of if stomach acid's at play. So doing experimentation with HCl. What I wouldn't recommend is doing the baking soda test. That's kind of a common one, just because I've had a few clients that got really messed up from it. Mm-hmm. I don't know what happened. I think it just kind of changed the pH of their gut. I've had 2 clients who like had pretty bad incidents from doing like the baking soda. It's not something I've ever used. They just did it on their own. But have you heard of this before? Like you drink baking powder or baking soda, and then you have to like wait and see how long it makes you burp. It's like an at-home kind of test. I don't know all the ins and outs, but I do know that like I've had a couple clients do really poorly doing that. So it's one I try to like steer people away from. But HCl is a pretty good tool to experiment from a low stomach acidity standpoint. And I think if you have high stomach acid, you could try, if you think you might have high stomach acid, trying some histamine reducing things might be really interesting. So things that stabilize mast cells like quercetin or nettles leaf, even things like DGL, which is used a lot for like calming the stomach lining, also has some mast cell stabilizing effects, some dehistamine type effects. Mm-hmm. So again, I might try a few of those things and see if you can get an indication, but I would say most of the time, a good way to kind of discern is just like how symptomatic you are after eating. Mm-hmm. Especially not just reflux symptoms, but like that like very full feeling, indigestion type feeling, burning type feeling, like feeling like you just ate a bowling ball type feeling, burping, bloating, that sort of stuff.
Mm-hmm. And anyone that's listening, DGL is a form of licorice root.
Yep.
I can't remember what the D stands for. It's like deglycin or what is it?
Yeah, it's like deglycinated or something. I don't know.
Yeah, that's what
Yeah.
But that's licorice root. We talk a lot about that in the other interview with Dr. Nicole Neza. And then HCl is hydrochloric acid, right? In the capsule
Correct.
form that some people will take, usually guided by a functional medicine doctor. And we did get a question about that. If someone was wondering if it's appropriate to take if you have Lyme or Candida, which is very specific, but
yeah. So HCl actually could potentially help fungal issues. Because again, if HCl is off, stomach acid is a primary mechanism for to protect us from overgrowth, infections. It helps modulate the microbial environment throughout the whole gut. So it's going to modulate the gut environment because it kills stuff as you're eating it. So it kills things like food poisoning pathogens, things like that. Like it's very important. And then downstream, because it affects the environment in the small intestines and therefore then the large intestines, it can affect what microbes are growing and which aren't. So I think that honestly, from a fungal standpoint, a candida standpoint, it can be very helpful. I'm less knowledgeable about Lyme, but I couldn't see why HCl would be bad for Lyme. I just don't know kind of all the ins and outs of that one. But I would say with fungal stuff like candida stuff, it could be really beneficial.
Is excessive burping a symptom of low stomach acid?
Yes. It's something I see a lot in my clients with SIBO. And really it's because, if food's not digesting well, it's fermenting somewhere. So you get gas being pushed up. And again, sometimes that gas can lead to more reflux too, because it's pushing everything up. Even if you have some extra acidity, or not extra, but if you have low acidity, it can still push what acids you do have up in the process. But I think that burping is a big one. Mm-hmm. I see that often. It's something I look out for and have in my questionnaires as something I need to look out for. And again, I have a lot of clients that are like, oh my gosh, I burp so much. Like this is me. And I'm like, well, do you feel pretty bloated right after eating? They're like, yes. So like, again, it's a pretty common thing, but excessive burping can certainly be a factor.
Mm-hmm. And you already touched on this a little bit with eating protein at every meal, really managing stress, but how would someone create more stomach acid or support healthy stomach acid levels? Anything else there?
Yeah, I mean, I think that understanding the cause is key. So again, if you have H. pylori, do some stuff to treat H. pylori. There's a lot of natural things that are helpful, different herbs and such that you can treat H. pylori. That could be a whole conversation on its own, is H. pylori. But if you have H. pylori, you'd want to take care of any H. pylori scenario, or even just get tested to make sure that's not a factor. I think if gastritis is a factor, you want to do some stuff to calm down the lining of the stomach, similar to like what the hope is with a PPI is that, you remove the acid and let the lining heal. But there's also some different herbs and things like DGL, like, this isn't really an herb, but zinc carnosine, Slipperyel, marshmallow root, like some of these things can coat the stomach lining, and can help protect the stomach lining from irritation. So like if gastritis is there, you could certainly use some of these methods to help kind of calm things down. If it's a bad case of gastritis or ulcers, certainly do a PPI for a period of time. But you could come off a PPI and use some of these herbal tools and more natural tools to kind of help calm things down as well. Mm-hmm. So, gastritis, you might want to focus on calming things down. If it's like a thyroid situation, you want to make sure you can double check thyroid labs with a doc, just to see where your thyroid's at. And then I think stress management's a huge one. So doing stress management daily will be key. If you're having low stomach acidity, Doing things that help the vagus nerve. Breath work is huge. I'll oftentimes recommend like 2 to 5 minutes of breath work before most meals to my clients. And that's going to activate the vagus nerve. It's going to help kind of bring blood flow, nutrients to the gut, which will then help with stomach acidity. So I really like any strategy that's going to help with stress management, optimizing nutrition. So making sure you have replete levels of calories, micronutrition that are going to be important for stomach acidity, I think is really big. Those would be the main ones. I would say too, things like alcohol, just from a lifestyle factor, I'd probably cut back on, if not eliminate for a period of time, just to help preserve the lining of the stomach, and to allow for that to be healthy. Those would be the biggest ones, I would say, from like a lifestyle approach standpoint.
Mm-hmm. Yeah, breath work can be huge. I do a video for anyone wanting to learn how to do that on my channel, and then also on Instagram. And I think that's where also a conventional doctor can be helpful, is like ruling out H. pylori gastritis.
Right.
Ruling out anything more serious, and then you can understand more of the root cause once you know, okay, don't have these things.
Right. And even like, I think a GI doc too, like if you need to get scoped or like check out any of the biggies, can definitely be a good resource to go to. Mm-hmm. Even if you've like gone to a GI doc before and maybe like you didn't click with them or didn't find them overly helpful, you could even go to your PCP if you trust your PCP and say, oh, I think I might have H. pylori. They can order a stool test for you.
Good to know.
Or again, they can run thyroid labs or look at some of these things, look at zinc markers or look at B12 or iron levels. They could look at things that might be at play. Mm-hmm. So again, you should certainly utilize all the resources you have available to you when you're looking into this stuff.
Yeah, that's a great tip. Do you have time for 2 more questions or?
Yeah, for sure.
All right. So 2 more questions. I thought this one was really good. How frequently should individuals with acid reflux eat during the day?
Yeah, it's a hard one. I feel like it's going to vary a lot. I think the conventional like rule of thumb is to eat smaller, more frequent meals from an acid reflux standpoint. And I would say that, I've definitely seen some people from a symptom standpoint do better with more fasting than that between meals, but not everybody. So again, it's like, I do think it varies a lot, and it would probably take some level of experimentation to figure out what works for you in controlling acid reflux. But yeah, I mean, I would experiment a little bit with it. Mm-hmm. If you feel like, again, smaller, more frequent meals helps to control things a little bit better. Or again, maybe like 3 square meals feels okay without snacks. Some people, again, go 2 meals a day. Again, it varies. I know, like conventionally speaking, it's very much more towards the higher frequency, smaller quantities. And that very much could work for a lot of people. But then I also think that there's some people that do pretty well with less frequent meals. If you feel like too that you have to have a lot of frequency, I wonder. I also wonder about motility of the stomach in certain scenarios there, like if there's poor like gastroparesis situation where things are just like motility's poor. Sometimes things like that help with motility might be beneficial in those cases. So I think meal timing is like a pretty variable one. Yep. I think it takes some experimentation to figure out what works. Maybe you're someone that is going to do best with smaller, more frequent meals, and then other people might do better with just eating 3 square meals a day. Just depends.
Yeah, I totally agree. I think it's finding that balance. Like some people are more triggered by large meals than others. So
right.
It's but you want to make sure you're getting those macronutrients and micronutrients. And you also want to make sure you're not grazing throughout the day, because then you don't get that clean sweep that can be really helpful. And so yeah, I think it's individual, of course, but just important to note, because that's a thing to really consider if you have acid reflux, is your meal timing and frequency.
Right. Yeah, it can be another lever for you to pull on.
Right. Exactly.
For sure.
So celery juice for reflux.
I don't know if I've ever thought about that for reflux. I feel like celery juice has been like kind of like a fad. I was really skeptical at first.
Mm-hmm.
I was like, what? Like, what? How's this working? Although I was really impressed. I read an article by Dave Mayo at Hack Your Gut. I don't know if you've ever heard of him. He would be a really good one to have on here, but he does a lot of circadian rhythm stuff. But he did an article on gut health and celery juice, and he did like, I wish I could pull it up. He did pull out different compounds within celery that he thinks are helping with certain people's symptoms. Again, I don't think celery juice is a miracle cure at all for like that. You're going to take celery juice and acid reflux and low stomach acid is going to be cured. Like, right. I'm skeptical of that. There could be some helpful aspects of doing that, but I don't think it's like a miracle cure. There might be some nutrients that you're getting that could be beneficial just from a health standpoint, but I don't think it's going to be like the answer for your reflux or low stomach acid.
Right. And it's so important to check your sources with stuff like that, because in my opinion, the medical medium is not a reliable source.
Right. No, totally.
Like have his doctorate, and you know what I mean? Like where he gets his information is God knows where.
Well, it's funny you bring him up because, you know, if I had a dime for every client that was like, well, then I did the medical medium diet, and like, again, then they're seeing me. So it clearly, it hasn't been efficacious at all for the clients that I work with. And sometimes it even makes them worse because they're just more depleted. Because it's
right. Yeah. And like, if it does work, like if celery juice does work for you, that's great. And not knocking that at all. I personally did try it for months, and it made my reflux worse, I think, because of the high level of acidity, but
yeah,
it's different. It's kind of like, you have to and always do your own research with that kind of stuff.
Right. No, I agree.
Yes. Well, this was so awesome. I really learned a lot, and I'm sure our listeners did as well. If they want to find more about you, where should they go?
Yeah. So you can follow me at Amy_Hollenkamp _RD on Instagram. Again, I have my blog, SIBODiaries.com, and we have the IBS Freedom Podcast. So you can listen to that pretty much on YouTube, Spotify, anywhere where you can really listen to podcasts, it's available. So you can check that out. We have more episodes on things like stomach acid and PPIs and things like that. So if you're interested in that, you can check those episodes out.
Great episodes. I absolutely love them. They have one on the vagus nerve, low stomach acid, like GERD. Definitely go check out that podcast. So thanks so much, Amy. I really appreciate it. It was great to talk to you again.
Yeah, great to talk to you too.
Have a great rest of your day.